things that I have prayed and just would give anything to see in 5 years, I've seen it now in 4 weeks. By day 2 of life, Luke started to go into a coma. The first 6 months of Luke's life were very traumatic, to say the least. He was in the hospital every week. We would get out for a couple days and be back. His pneumonia was just never really managed. For 6 months, he stayed at a brain damaging level. Every time I would see a doctor, they just pick one diagnosis to fixate on. So Luke has been given a diagnosis of CPS1, he's had a liver transplant, metabolic stroke, cerebral palsy from the stroke, and we also got an autism diagnosis. There were many nights that I would stay up crying, thinking, what can I do for him? Because I feel like everything I'm doing here is not working. Dr. Crawford takes us back, and he was looking over Luke, talking to him. He didn't treat Luke like any of his diagnosis, not one of them. He was looking at Luke to treat Luke what works best for him. This is a place of miracles. So before, I could never get Luke to dress himself. And the other morning I had his clothes laid out for him, and I was in the bathroom getting ready, and I walked back into the bedroom and he had already gotten himself dressed. He was completely nonverbal from the stroke, so never said a word, but he has started to talk. I was like, you get to go to clinic today and see all your friends. And I was like, are you ready to go now? And he said, yeah. And now he's trying, every night he's trying to sound out words. He actually sits at night and in bed and wants me to read to him. He's never done that before. He was not ever using utensils. And I've made videos of him since being here of eating his first cup of ice cream, literally from Chick-fil-A, because he can do it now. I just have so much hope for Luke's future, and just seeing the things that he's done in 4 weeks. I can't imagine what it's going to look like for him when we get home and we're doing home care. Who knows, maybe a year from now I will be sending y'all T-ball pictures and whatever he wants to do.
You're doing awesome, dude.
This place is restoring health, restoring hope to families, and truly changing lives, not only of the patients, but of the families as well.
Hi everybody, welcome and thank you for coming. I'm so honored to be here because usually I go to research conferences and families aren't there. This is great to talk to all of you about your stories because family stories really motivate my research. They always have. And I see up there on the program it says acquired brain injury. When I did the slides, I realized they were mostly on traumatic. So that's why this says traumatic brain injury. I don't have any conflicts of interest. But I want to let you know where I've been working because I've been in the field for 44 years. And I started out in Pittsburgh at the Children's Institute. And this book, Mark Ilvasaker and I planned and worked, called Head Injury Rehabilitation Children and Adolescents, because we opened a pediatric unit, but we realized when they left us, people didn't know what to do. So we wrote this book, and it's very old, but it's helped me get a lot of jobs, I'll tell you that. But I worked in DC, I worked in Atlanta, and my recent position was at the Center for Disease Control. I was a senior scientist on the traumatic brain injury team, and as you've heard in the news, it's no longer there. So I'm still working on projects, and part of the nice thing about working at CDC is that I learned about numbers. And I used to think, why do we worry about numbers? But I learned about large data sets. So some of the studies I'm going to tell you about are on those data sets. So first I'm going to talk about epidemiology. Do you all know what that is? That's really the numbers, big numbers, what's happening in the field. And one of the things we know at CDC for years, they followed the number of emergency department visits. And this is older data, but that shows you how many were in children. And by the way, these slides will be available to you, and some of them I might go through quickly, but I wanted you to have the resource. And you see that unintentional falls is really a lot of the reason. I know we hear a lot about sports concussion, but these are the reasons. This is older data, but it's really true. And also CDC published related hospitalization. Again, unintentional falls were the leading thing. And unfortunately, there's deaths, and we don't like to hear that. We don't want that to happen. But I did a study with Children's Hospital of Philadelphia looking at their system, and what we learned is when children have a concussion or mild brain injury, they may see their primary care physician. In their system, it was a high amount, and there's no data on that. So what we say about emergency departments, it's way more than that. And these are the groups with the highest rates of ED visits. And as you see, children ages 0 to 4 years are the highest kids, followed by teenagers. Now, this is a big data set called the National Survey of Children's Health. And what I like about it, it's parent reported. So parents are called and they answer questions. But from this, we estimated that 4.2% of children ages 6 to 17 were ever diagnosed with a TBI, and we learned that they were more likely to have disabilities, school and social impacts, and various health conditions. This is another study I did with Children's Hospital of Philadelphia because we wanted to look at the injury mechanism over the pediatric age span. As you can see, the younger kids, 0 to 4, it's falls. But as kids get older and get into adolescence, it's sports-related injuries. And we did talk about that. We've written papers at CDC about sports-related injuries. So a lot of them, 45% of the sports-related injury TBI, contact sports like football, soccer. And this is something I'm very proud of. I was invited to join CDC because they were required by Congress to write a report on children. And this came out in 2016. I believe it's still on the CDC website if you'd like to see the whole report. But Ann Glang, who's very good with school age, and Brad Kowalski, who's a physical medicine and rehab doctor at Cincinnati Children's, joined me. We also had a nice review panel that included parents, kids who grew up and they are adults with they living with a childhood TBI. We had probably close to 100 people who gave us feedback on this report as we were writing it. Now, I want to talk about how it affects children. And what's nice is what's advanced is imaging. And we didn't used to do a lot of imaging, and that really tells us what happens. Not all children, especially those with concussion or mild TBI, have imaging issues, but it is important. And age of injury means something. So we used to think if kids younger than 5 had an injury, their brains were plastic and they'll be fine. I've had many parents tell me the doctor tells me they're going to be fine, but they're not. And so that's a very important issue. Past and current health history means something. So those who had a lifetime history of TBI from that study I did were more likely to have had ADHD, a learning disorder, delay, before the head injury. And it's very heterogeneous. Every head injury is different based on how the injury happened. So if someone was abused, they're going to behave very differently than if they just fell. Individual child characteristics and the child's environment. And I'm going to talk a little bit about outcomes, but fortunately, there's more research on outcomes in kids which tells us that they need care. We just can't say, oh yeah, they're fine, they're home from the hospital. We have to take care of them. And I show you this because what we want kids to do is graduate from high school, college, get a job, and have a nice quality of life. But in that one corner, I have someone in prison because my colleague Drew Nagel has written several papers on screening individuals in the justice system and finding out they had a history of childhood brain injury, and many of them were never treated. And childhood brain injury can change your behavior, which can get you in trouble. And also outcomes may depend on parent factors, like if you are household income is low, you might not have access to care. Lower parent education was associated with poor outcomes from parents because parents may not understand what to do, and education isn't always provided. Now, this is how children are different than adults. They have many transitions in their life. They go from preschool to kindergarten, from elementary school to middle school to high school. And I have Wile E. Coyote there because when they're done with high school, it's kind of like falling off a cliff. And I'll talk a little bit more about that, but I've run into so many parents who say, my child graduated, we're having trouble getting them this and that now that they're done. So that's important. And CTE, I've been always asked about children. We don't know enough about CTE in children because there aren't these long-term studies of kids. So we have to look into that. Now, first I'm going to talk about young children, younger than 5, because injury mechanisms, as you know, and I raised 3 boys, they were always falling and wrestling, and so young children are more likely to fall, and we wrote a paper explaining what happens in the falls. I was very lucky to work with a large data set in this. So we knew that we looked at child actions and adult actions. So child actions were more prevalent when kids were a little older, like above 2, when they were walking and running around and skipping and jumping. But younger than 2, or younger than 1 especially, it was more adult actions. And adults, we learned, are dropping kids, pushing, carrying. So one of my kids saw this. He said, hey, did you drop me? I said, I probably did. So you have to watch what you talk about. And these are all the products we learned about. It's mostly furniture and surfaces, especially for kids younger than 2. But as you see, at 4 years, children are starting to get into sports, so they may have sports and recreation-related injuries. But we learned that children younger than 2 had the highest rate of falls, and that's the time when they're gaining independence. We also looked at this data on fractured skulls in infants, and we learned a lot. And I did this with a multidisciplinary group, including emergency department physicians who see abusive head trauma. And we learned that the most common caregiver actions were placing, dropping, or carrying. But what we said at the end is physicians don't always know if a child was abused. The parent may come in and say, oh, they fell. So we suggested to physicians, please ask more details about the injury. Just don't say, okay, they fell. Ask for more details. Now, young children, and this just came out, symptoms of concussion are very different in children younger than 5, especially younger than 2, because how do we know what happened? Their parents reported their observations, versus a 10-year-old could maybe tell you, I have a headache and I fell. A 1-year-old can't tell you that. So Miriam Bocha at University of Quebec, she developed a questionnaire for physicians to check off kids to see what's different about their symptoms if they're young. So sometimes they were toilet trained and they're no longer doing that. They're more irritable, but it's parent report of what happened. This is one of my favorite pictures since I raised boys, because I've talked a lot to Head Start people and preschool teachers, and I'll say, okay, these are symptoms of a TBI: organization, memory, behavior regulation. And I always get the same comment: this could be my entire class. Why? Because there's a range of development between 0 years and 5 years. So how do you know the kids have an injury? Well, what we've told teachers is if they come back to school and their behavior's changed, you need to talk to their parents. So when I was very lucky, back in 2010, I was awarded a federal grant to study kids who had their injury before age 5, but they were now between ages 6 and 9. And we learned so much from this study. In fact, we had a lot of parents come to us. 60% of the kids in our cohort were mild, because parents came to us and said, they had a concussion, but my doctors won't listen to me. I keep telling them they changed, but they said they look fine to them. So one of the things we did with this study is we tested all the kids individually. We did hearing screenings, which I'm going to talk about, but we learned that they all scored in the average range on standardized tests. And as you know, if you're in school, unless you score 2 standard deviations below, you don't qualify for special services. So these kids would not get that because they weren't testing low, but they were very different from their peers who had just orthopedic injuries in more complex measures like pragmatic language, which asks the kids to tell a story, or reading comprehension and executive functions and behavior on that measure. They were very different. And what else we learned, we screened all the kids' hearing. When I was in rehab in the 80s, we did that all the time to make sure they were okay. But that's not done anymore. And we learned that TBI group had more failures, and I'm going to talk a little bit more about that. They experienced headaches long after the injury, and their parents didn't always know. And multiple injuries can affect their index. So let's say you have your first one when you're 3. Knowing my boys, one of them had several concussions through elementary school and high school. So if you start young, you could still have more. Now I want to mention hearing, and this is a little bit about the anatomy. The reason I did this slide is your hearing is in your skull. So if your skull is shaken or hit, it can affect your hearing. And what we learned in that study is many parent report on child fair screening. 40% of parents reported they did not understand the hearing screening results. 50% said that they did. We suggested if they failed the screening, please go to your pediatrician and get checked. And one mother did because she was worried about her daughter. Her daughter had a moderate hearing loss, got hearing aids, and she was just about to be diagnosed with autism at school because she wasn't responsive. Well, she couldn't hear. So this is an easy way to check things out, to see if your kid's hearing. Then one of our colleagues, children with a history of TBI are 2.6 times more likely to have hearing complaints. So my point is we need to check their hearing when they experience this. They have risk for hearing loss. They need to be followed up. And I don't hear a lot of people talking about this, so I want you to know that. It's not systematically screened, and it's not readily observable. Like I mentioned, the one child in our study, they were going to diagnose her with autism in school. They had never checked her hearing, ever, in school. So this is very important to check. And we created a one-pager to give to families at Children's Healthcare to say, hey, get your hearing checked. I also had an intern who looked at adaptive functioning, and even children with mild, complicated injuries, it had a lasting effect on their adaptive and complex language development. So we need language, especially as you get older, and what we've learned from looking at preschool kids is they may look fine at 3 or 4 at the time of the injury, but when they hit 3rd or 4th grade where you're expected to do more, like read book chapters, that's when the effects may appear. So we want people to do some pragmatic language intervention, and we created this one-pager for parents to say, hey, get your child in a friendship group. Make sure they're out socializing, and that way they can practice. So these are the policies for preschool children. You know, there's the services available for preschool children: early intervention, Head Start, school, preschool, and hospital. But what we learned from our study, this is in the state of Georgia, not Texas. None of the kids ever were referred to any services, not Head Start, nothing. None of them were. We were surprised. And they were enrolled in preschool without any accommodations. And one of the parents told us that her child was acting out at preschool, which was different. And they told her they were going to remove her from the class. She goes, why won't they work with me on trying to help her stay there? What we know about follow-up is all children, especially preschoolers, do see pediatricians. And when I was at CDC, I worked with the American Academy of Pediatrics to develop one-pagers for pediatricians to give to parents of young children, and for them to know they need to be evaluated and helped. But there's not a systematic way from the TBI to follow-up care. Now I'm going to talk about school-age children, because again, this is the same study I mentioned previously, but this is all on school-age children. They were more likely to have unmet needs for care coordination, suggesting that even their elevated access to services it's insufficient to meet their needs. And many of you, including Texas, might be familiar with return to play laws. I think you have that in Texas, right? Yeah. 50 states have it. I was around working with the NFL when they were pushing us to develop this, which was great because it brought attention to childhood injury and concussion. But that helps in most states, but that's only for athletes, right? It's not for non-athletes. But parent education and household income are very important. I already mentioned that, sorry. And we looked at 2 large surveys on adolescents called the Youth Risk and Behavior Survey, and they were only asked one question: did you ever have a sports-related concussion at the time? And what we learned is those who said yes to that, and these are adolescents reporting, were more likely to have trouble in school. Their grades dropped. We also learned in this study that they were more likely to be expelled from school, get in trouble at school, because nobody was paying attention to them at school. They might have helped them get back on the athletic field, but they weren't paying attention. And another big area is transition to adulthood. So there isn't a lot, it's very important, but there's not a lot done in this area. With children with medical conditions, many of you may already know this, how important it is to have a medical home, whether it's a pediatrician or family doctor, someone that you know well who can help you. And we really looked at healthcare transition. Again, the medical home is very important. Sorry. So we want them to set goals, understand what they're interested in doing. Wow. When I ask people that, they say nobody's ever asked me that. In a lot of rehab settings, they tell kids what to do. They tell parents, you're going to do this, instead of saying, what would you like to do? And we also think this healthcare trend, having a medical home, giving kids personal responsibility for their health care, and getting them a social support, and of course in this era, technology. But this is what they told us in a program that I ran for teens that I'll talk a little bit about. This is what they told us. They want to go to college. They want to drive. One of them said, I don't need to study. I always put that in because that's what my sons used to tell me. But this is with kids who have developmental disabilities. There's a lot of literature on that they have higher, these are older studies though, but success depends on disability severity and access to resources. And that's what I like about this conference. They're telling you all kinds of resources. Kids with special health care needs really need to, if they're going into adulthood, they really need to understand their condition and what they have to do to take care of themselves. Now, TBI transition, these are older papers, but they looked at teens enrolled in special ed, and they noticed they had lower rates of employment and less enrollment in post-secondary education. Those overall, they were less likely to have, they may enter special education program, but the only way you get a transition plan in school is if you're in special ed, and not everybody qualifies for special ed. So here's a few things that are very important that we learned from the program. We went a medical home, self-determination and self-management, asking teens, what would you like to do? How can we help you manage your care? Accessible environment and a circle of support. So these are 4 guys that I really like. We did a program called the Brain Program at Children's. I have a paper under review about it, what we learned, because these kids, we let kids come for free, stay for free. They could come from rural areas of Georgia. And these kids were awesome. These boys, the one in the Fitch shirt, he wanted to go to medical school. And we tried. We went out to his school because his mom was saying they aren't doing anything to help him. So he was in AP Science, and when we went out, the teacher and I, they said, oh, he just has to have a C to graduate. I said, he wants to go to medical school. Have you listened to him? So they agreed to do tutoring, which he did for a couple years, but then he told us it was really hard for him to do, and he couldn't join his sister in medical school. But his dad owns a company, so he went to work for him. He now has a baby and is happily married and good job. That's a success story. So what do we know about models of care for kids? Well, children are somewhat different than adults because there's really two models of care, the medical setting and the school setting. And technically that means they should get care, follow-up care, right? But we're learning because of different levels of diagnosis. In healthcare, they diagnose you medically, right? The physician has to say you had a traumatic brain injury. Schools rely on parent report. And we've gotten calls over the years of schools that call us and say, this child is so different. And the child told me they fell, but we can't get the parent to help us. And they can't do anything unless parents agree to it. But we also know that a lot of kids with mild concussion and mild TBI may not seek care because their parents think they're okay. This kind of shows you how management occurs in a health system with primary care. You see hospitals, home care, hospice, post-acute care. What we learned, though, from this study is that a physician champion for a child is very important, the same as medical home. Electronic healthcare records can ensure consistency across individual areas in a hospital. And many pediatric healthcare settings have procedures for children who are uninsured. I don't know whether that's true in Texas, and I know in Georgia they try to, but they can't always cover them if they don't have insurance. Here's some take-home points. They need consistent guidelines, and you may have seen recently there's more guidelines coming out for taking care of kids. They aren't always proven. Sometimes it's a bunch of healthcare professionals writing it to say this is what we know from our experience. But silent problems can occur in complex settings. So if someone's able to walk, for example, and it's not observable, but they're really having trouble thinking, that may not be observed. And what's really important is the link between healthcare settings and schools. Doctors and healthcare professionals need to communicate to schools what the child needs. And at CDC, we still have this form up, I think. It's a discharge checklist that physicians we want to give to parents to say, what they need at school. From a health standpoint, they can't always predict learning, but they say, oh, they need extra time because they're slower in thinking. And families really need support. Because as many of you know, it's very stressful after the injury, and we need information provided to them about TBI and helping them solve the problems. Now, return to play and activity for children. So high school athletes have the highest return to play policies, and if you're already enrolled in high school athletes, you're going to get a return to play because it's required by law. But if you're 12 and you had a high school injury or athletic injury, you may not be taken care of the same way. We've had multiple calls at CDC about that. Return to driving. So that's kind of scary, isn't it? I know raising my boys and going out with them the first time when they had their learner's permit, it's scary. And many teens want to drive. In Georgia, Children's Healthcare and Shepherd have programs to train kids, to test kids to see if they should be driving. And that's very important for adolescents. Now, this is Linda Ewing Cobbs, who's been in the field a long time, and I like this. TBI of any severity can negatively affect a child's future ability to learn and perform in school. That's absolutely right. And I want to mention a little bit about educational services. Some people have written outcome studies, and these are a little bit older, but they say if you have moderate to severe TBI, this may happen. Higher rates of grade retention, more often need special education, but they may not always qualify for it. They may qualify for physical therapy or specific therapy. But 14% of children that we learned from this data need support at school who had a mild TBI. And students who have moderate to severe TBI may need more support over time as learning becomes more complex. So here's another outcome about employment. Very low rates we're noticing. And as I mentioned in that outcome slide, there's studies showing high rates of criminal behavior and incarceration. And we don't want that to happen, right? We don't want kids going into the justice system. So here's some gaps. And some of you family members may know, did you get education about the effects of TBI and what to watch for? This is from Ann Glang. She found that 51% of staff was not informed of the injuries in Oregon. This is in the state of Oregon. And here's some gaps in educational services. And one of the big points is there is a TBI category under special ed. When we first wrote it, we just said the parents need to bring a letter saying they had a TBI. What's happened over the years is schools are starting to say, but their learning isn't different, because sometimes right after the injury, the child is still testing or acting like they did prior to the injury. But they're not, they need follow-up to make sure they're okay. State directors of special education said only 40% of students with TB were classified under that. And it's been designated now as a low incidence category. And as you can see from those original epi slides, there's a lot of childhood brain injuries, right? But they don't always test poorly when they're at school. And here's some of the policy and legislation for schools. Return to play and return to learn laws. So even though there's a traumatic brain injury category under IDEA, some states, I think 10 states, have done return to learn laws because they feel it covers general education, that the kids may get attention if they're not in special education. And technically, I don't know whether anybody's a school nurse here, but technically, if a child reports to school with a health condition like TBI, they're supposed to see them and write up a plan for them, for their health. And believe me, school nurses have told me they don't always hear about it at all. I've spoken at school nurse conventions, and I remember one, like half the room stood up and said, "We never hear about the TBI." That's not right. They need to be involved. And of course, there's special services laws, special education laws, IDEA. Kids should be getting care. Schools focus on learning. This again shows you the kind of supports kids can get. Transition services is a big one. We also learned that existing procedures for helping students aren't always in place. And kids need to be tracked on a regular basis so that if they develop something, it's observed. So there's a program in Pennsylvania called Brain Steps and one in Oregon, I forget what it's called, but both of them, we did a study at CDC where they looked at their existing programs and compared to states that didn't have any statewide program. And they do both programs, the minute the child enters, they follow them till graduation. So if you come in when you're 10 and you're doing fine at school, but they follow them every year, the school staff has to report to Brain Steps every year. So if they see issues, they can address them. And here's some promising practice, parent involvement. And I'm working with a gentleman right now, he's 62, he's close to my age. He had a brain injury when he was an adolescent, severe, and he got a master's in social work. He has a family. he's done very well, but he's starting to write about his experiences because he still has a lot of the issues he's experienced as an adolescent. Memory problems, he forgets things. He's learned some strategies, but he said one of the biggest supports over time was his family and his persistence, and that's very important. I better check the time. We doing okay? Yeah. Now, technology, the good news is, since I started in the field in the 80s, technology's really come around, and I see many kids here using iPads to communicate. That's all good news. And cell phones, especially. Kids can when we did the brain program, we taught kids how to keep themselves organized on their phone and set up alerts. Now schools aren't always letting cell phones in, so I don't know how that's going to work out, but technology is helpful. And communication between healthcare settings and schools, that's so much needed. Especially educating schools about the child's needs is very important. So one of the things you may have heard with adults is there's a lot of work on traumatic brain injury creates a chronic health condition. Have you heard about that? It's big with adults, and two other physicians and I decided we need to write a paper on children. What was interesting in the literature of children, there's lots of literature on unmet needs, meaning they had a need, but it wasn't met. And that's what made us think this could be chronic. We need to call attention to it because we want children to be taken care of at school. So this paper is available if you have any questions. So I'm going to summarize. Oh, I'm running over, sorry. And just say we need to take care of kids. And this is a sign I developed for the report to Congress. Keep in mind these three words. We need to recognize that the injury happened, monitor kids over time, and take care of them. And this is one young lady. I just want to tell a quick story. I worked with her in the 80s when she was 5 years old, and she was going down the stairs to show her father her new patent leather shoes, and she slipped and fell into the cement wall. And she had, of course, went right to the hospital. She had a moderate to severe injury. She had to have a portion of her skull removed, and she did really well. She was reading at a 4th grade level in kindergarten, so she was very, very bright. So at the hospital, once she recovered, and they just sent her home and told her parents she's fine, because she was talking, she was acting to them like she was fine. But after she was in school a week, the parents called us and said, the school wants to talk to you. So the school invited us to come out and observe her. And the kindergarten teacher said, okay, she's very smart and she reads to the whole class, but I'm gonna let her just sit, like you watch. So she's told the class, you guys draw and color, and all the kids are drawing and coloring. Not Megan. She was spraying glue all over the kids. She was standing up and doing all these odd behaviors, like pouring glue on the table, getting water and pouring it on her paper. She was doing all this stuff. So we brought her into rehab, and at that time, she could stay with us for a year. And then she was in special ed all her life, but very smart and a very supportive family. So this is her. I still keep in touch with her a few years ago. She has a master's in health administration. She works for Blue Cross Blue Shield. She has a husband, and there's 2 of her 3 kids. She had a 3rd kid. She's very successful in life. Why? Because she had family support and persistence. Very important. She's a great story. So I've included references in this talk, and what I want to say, we need to keep doing research to make sure kids have a quality of life, because TBI is not just an event, it affects your whole life. So, do you have any questions? Yes? Yes, I submitted them, so I guess there's a portal where they'll share them. I'll ask at the desk, yeah. Yeah, thank you. Yes? Ooh. Mm-hmm. Yes. Yeah, so they said, oh, was he ever evaluated by an audiologist? I think you should, I suggest you try it. From what we learned from our study from that one child, she got hearing aids. She was a different child. And good for you. Wow. Oh, wow. Yeah. Yeah, yeah, you may have to speak up. Well, ask to try, you can try one, and hearing aids have really changed over the years. They're much better now than they used to be, and there's different kinds. So I suggest if you can do it, if you get it covered by insurance, to try it to see if that helps them. Mm-hmm. Yes.
So if a student is identified as having a TBI and gets special education services in the public schools, at what point or what is the transition to go to like 504 for post-secondary since special education terminates it?
You're exactly right. And
What's the...
well, there needs to be a plan. And actually, I used to teach in college, and in colleges, there's a disability office, but it's a student's choice, and you're not required as a professor to follow what they need. So I used to have students bring me accommodations they needed, and they would say I was the only professor that would allow them to take extra time on a test, for example. So that a lot of work is needed there to make sure. I think it requires parent education and getting their students to know what to do in college. But there's a lot of work yet for that. You're right. Special IDEA ends at high school. So colleges are not required, well, they kind of are under the ADA, but they don't always do it. It varies from university to university. So again, we need to teach kids and parents to be advocates and speak up for what they need. Yes. Oh, I'm sorry, do you have one more question? Okay. Uh-huh. That's okay. Yeah, it takes some strong advocacy, doesn't it? Yes, it is. Yes, it is. That I agree with you. And I'm hoping we get community setting set up by working with this. When I was at CDC, when I first started, I said, kids are in the healthcare setting for 5 minutes. They're in school for the rest of their lives. So I convinced them to fund some projects that I mentioned. And they're done, and they're starting to publish papers on what they learned. One of the things one site learned, they were trying to recruit kids in Ohio that doesn't have a formalized state program. They couldn't find any. They were calling schools, oh, we don't have any. And so that what they did was they went to a healthcare setting and said, can we recruit through you and follow the kids? And that's how they found them. So you see, schools don't always know or have a procedure in place to take care of them. Great questions, you all. Any other ones? Well, there's my contact information. Now that I'm no longer at CDC, I'm still at Emory University, and I plan to keep working even though I just turned 70 and I could retire, but I'm not. Thank you. Thank you very much. And thank you for telling me your stories, because that influences all the research I do, really. Thank you. And let me know about your hearing, how that works. But that was shocking to me, what that poor family went through. They were told their child had autism when she did not. She just couldn't hear. She wasn't responsive because she couldn't hear. Yes? Uh-huh. Wow. Do you have medical records from that time? Or does your pediatrician? I mean, the fact that he had an injury, I think, makes the school, somebody needs to check his hearing, because it doesn't necessarily heal. So I would get his hearing checked. Schools used to screen. Do they still do that? Yeah. Yeah. Uh-huh. Oh. Uh-huh. Oh. That's how they're doing it. They aren't doing. Wow. Well, most children's hospitals have a pediatric audiologist that will do a more detailed examination. So I encourage you to consider that, because he could still be having hearing trouble. Yeah, thank you. Yes? I think anoxic injury, any kind. Yeah, now traumatic brain injury to the head, of course, is going to impact it, right? Oh. Oh. Mm-hmm. Wow. Intervention. whole life.
It was on his record before he was a year old, was when I was seeing it.
Wow. Well, and he might have it, right?
Well, just like as soon as we left the hospital, they were kind of like, he's autistic. So it's just with what you're saying, I'm kind of like, he passed his hearing, but I wonder what the primary children's audiologist says.
Yeah. And you know what?
Curious if it was an ABI as well.
Yes, and you could get a hearing loss from an anoxic brain injury because the blood doesn't go to your nerves. It's a different mechanism than being impacted with a head injury, but you could still get it because it cuts off blood supply. Yeah, thank you. Any other questions? I'm sorry to keep you guys waiting.
I was going to say, speaking of anoxic, so since the CDC's not there anymore, is there anything, any organization or studies that are going to pick up on anoxic brain injury statistics?
There are some studies, not very many, and they're mostly from university settings.
Yeah.
Because that act in 1997, we were only allowed to look at TBI at CDC because it's the act the government said we can only, traumatic. But we really pushed to try to get other aspects in, and we're not successful when we were there. But there are studies about anoxia, and there's a lot of similarities to traumatic.
Yes, but there's a lot of non-similarities
Yes.
in outcomes
Yes.
and long-term outcomes.
Mm-hmm.
And is it possible we could work with like Brain Injury Association of America?
Yes, they are. Yes, they are recognizing all kinds of brain injuries. They've changed that too from TBI to all kinds. And they just hired my former team lead at CDC. She's director of a research initiative that they're starting to look into all of that. So check in with BIAA and ask them what they're doing.
Okay.
They do have, I think, some information on their website about anoxic brain injuries. So that's the only group I know that's active with it. Some of you may know of others, but thank you. I don't mean to keep, I hope nobody's waiting to come up here to speak.
You still have like 10 minutes. Your time went to 4:30.
Oh, I thought it was 4. Sorry, kids. See, my age is showing. Okay, I went through those slides so fast because I was worried I didn't have enough time. So,
Unless I read it, I don't have my book, but unless I read it, okay, yeah, you're 4:30.
oh, good. So more questions. Yes.
I'm just curious, I'm a social worker and I've worked with a lot of families in school settings, and one of the things you said is that the information, for example, when a kid wants to come back to school, right, sometimes the communication from the parent doesn't get to the school. I'm curious, through your research, what advice you can give me as a social worker to ensure that I support that layer. Because I've worked in school settings, but I don't hear TBI, but that doesn't mean it's not happening.
Right. Good. So we used to have a lot of handouts on our CDC website. I think they're still there. They're called Heads Up. You can look there. And let's see. There's resources. What state are you in? In Texas. There are people at Texas Children working on return to school. And they've contacted me about collaborating, and she just created like a one-pager for doctors to send to school. And so I think I have your contact, or you can email me and I can find it for you. Yeah, or find her, because you're in Texas and she's trying to get things going with back to school. Great suggestion. And sometimes parents may not always know that their kid had a traumatic, like they may have fallen outside, or when I was growing up, I was hit in the head with a croquet ball by my neighbor. That hurt. And I was laying down on the ground, and this was in the 60s. So they went to get my mother. My mother goes, well, it's only 10 to 5. She can come in at 5. And so they helped me up, and we played croquet. But, you know, those kind of things, my mom didn't understand it. My point is, parents don't always understand or know about injuries. They didn't tell her. No, they did tell her, but then people didn't know what that meant. So it's always good to give education, really, and recognizing. So Nebraska in Lincoln, we did a visit there from CDC, and what they do is they follow their attendance office. So let's say a parent calls in and said, my child won't be coming to school today because they were in a car accident. The nurse immediately calls and to ask. So there's measures, some schools are doing things like that, but I think it's educating the whole school environment, because kids could come back and they know that they're different, they've changed, but they don't know why. Sure, thank you for informing me about the time. More questions, any other questions?